Okay, hello guys. Ogundare Adekola is my name. I'm a nurse by profession. Life coach Adeoluwa has graciously invited me to speak with people living with hypertension in commemoration of the World Hypertension Day. While I was trying to brainstorm and think of how best I can explain the concept, the physiology of blood pressure and the pathophysiology of hypertension, I came up with an idea which I think is going to benefit everybody, and it is well explanatory, just a practical demonstration that I'm going to do for us. So I want you to take your seats and follow me as. So blood pressure, it's a product of cardiac output and peripheral vascular resistance. Cardiac output is just the amount of blood that your heart is pumping in a minute, while vascular resistance, as it were, is like a resistance that the heart needs to overcome to create a flow, to create a circulation, like when the heart is trying to pump against a resistance. Because for a circulation to occur, the heart is pumping the blood, it pumps it through blood vessels. Those blood vessels are like pipes that conducts the blood from the heart to the other body parts and back to the heart. So there is a level of pressure required to overcome the vascular resistance. Once this vascular resistance increases, automatically blood pressure increases, because you will need more pressure to overcome the increase in the vascular resistance. So they are directly proportional. Once anything that affects the vascular resistance affects the blood pressure. Anything that affects the cardiac output as well affects the blood pressure. But my attention today is on the vascular resistance, and that is what my practical demonstration will be about. So if, like I said, once the peripheral vascular resistance goes up, the blood pressure as well goes up, and that is when they say you have high blood pressure. If the high blood pressure persists, they tell you you have hypertension. And one thing I want you to understand about these blood vessels is they have the ability of getting narrower or getting distended. If it's getting narrower, that's what we call the vasoconstriction. Once it gets narrower, the narrower it is, the higher the pressure. Once it gets narrower like this, then the heart will need more pressure to pump blood into it. I don't know, maybe you've done something like this before, when you hold a pipe, a hose or a tap that is flowing, and you try to use your hand to block a part of the part of the pipe. You will see that the pressure will increase. That water will be flowing voraciously. The pressure will increase. That is what happens when the blood vessel gets narrower. Then there will be increase in pressure. Then they say you have hypertension. So I'm going to be using pure water, this sachet water, to demonstrate what happens in hypertension and in peripheral vascular resistance. So let's assume this is the heart. Obviously, this is not the shape of the heart, but let's just assume this is the heart. There is a range of pressure that is normal, that is expected for you to pump blood out of this heart into every other part of the body, and we range it. They just say, okay, let's say a normal average is 120/80, but the borderline is as high as maybe 140/90. Anything above that is hypertension. So, but in this demonstration now, let's assume this is the heart, and let's assume this is the heart. Yes, I've created an opening here. You can see this. So as I was saying, you can see this, that as because this channel is narrow, for me to create a good circulation, I need to increase the pressure here. That is to sustain this circulation. And if this pressure continues, you can see the blood vessel is enlarging. That is when the pressure gets sustained. It keeps enlarging, and at the end, it leads to a burst. So you can see what happened as the pressure keeps increasing. If the pressure is not controlled, then it could lead to a burst. If this burst occurs in your brain, that is when they say the patient has stroke. That is exactly what causes stroke. When there is a persistent increase in the pressure and it's not controlled, then the blood vessels in the brain has a greater tendency of bursting, just like you saw in what I did. That is how stroke occurs. And if this burst happens to be in the heart, maybe the blood vessels that supplies the heart, then that's when you hear something like heart attack. And when you hear something like heart attack, because it leads to infarction. If it happens in the aorta is a very big blood vessel that's connected to the heart. If it happens there, then it leads to almost instantaneous death for the patient. So that is basically how the vascular resistance is related to the blood pressure. And many of you, they might have told you, try and be exercising, don't eat fatty food and things like that. Even some of you, they say don't be thinking. When you worry, they say you worry a lot, you are not careful of your blood pressure and things like that. You might have been wondering, how does all these things affect my blood pressure? Let me help you. When you stress, let me start with stress. When you are stressed, when you worry yourself, when you are emotionally down and things like that, or you are anxious, you are scared, there are some hormones that are released in your body. There are some chemicals, let me put it like that. There are some chemicals that are released in your body. We call them stress hormones. There are just 3 of them. You have cortisol, adrenaline, then norepinephrine. The 3 of them, they are potent vasoconstrictors. They are potent vasoconstrictors. Like, the effect they have on the blood vessel is they narrow the blood vessel. In order for them to carry out their own function, they narrow the blood vessel. And when they narrow the blood vessel, peripheral vascular resistance increases. Like I said earlier, the narrower the blood vessels become, the higher the peripheral vascular resistance. So that is how your emotion, your stress affects your blood pressure. And once the peripheral vascular resistance goes up, your blood pressure as well goes up. Obesity, when you keep adding weight, the amount of fat in your body increases, and these fats, they have the tendency of lodging inside the blood vessel. Once they lodge inside the blood vessel, they create an occlusion, they block it. So it makes the blood vessel narrower, because it forms a plaque that attaches to the wall of the blood vessel. And if this is not controlled, if you keep adding weight, keep eating fatty food, it might lead to a total blockage. And this is what is going to happen. The blood pressure, the vascular resistance increases, the blood pressure increases, and you are at risk of stroke, heart attack, and different other complications. Old age as well. We all pray to live long, and I pray we all live long in Jesus' name. The longer you live, the more your blood vessel loses its elasticity. So the ability for the blood vessel to expand and collapse is reduced, and that increases the peripheral vascular resistance, and that ultimately increases the blood pressure. So those are just the basic predisposing factor. You are still smoking, you are not helping your heart as well, because the major component of the tobacco you are smoking is a potent vasoconstrictor. It also narrows your blood vessel. So the more you smoke, the narrower your blood vessel becomes, to be respected. And you need to help yourself by helping your heart as well. Avoid everything that can increase vascular resistance in your body, then you will be fine. So thank you once again. Ogundare Adekola is my name, and once again I'm grateful to life coach Oluwa for this invitation. I hope this has helped you. Thank you. God bless.